Hi, so welcome back to Angie Tells All, and this is my 36 weeks pregnancy vlog. So, not a whole lot has changed medically since I did my last update. I've still been doing the non-stress tests twice a week. I had one today, and they've all been fine, no issues there. My next one is this Friday. There are Tuesdays at the hospital and Fridays with my regular OB, so that has been going good. They've been checking the amniotic fluid, everything seems good there. They did do one cervical check last Friday because I saw one of the midwives and I had told her about my cramping that I've been having off and on for the last two or three. I think this will be like the third week I've been having it. So like 2 or 3 weeks. And I told her, I'm like, this has been ongoing. And so she offered a cervical check and she was like, well, do you want me to do it? We don't have to do it. So I was like, sure, go ahead and see if anything is going on. And nothing was going on, which, I know that that can change like that. Like it can change just because you don't have any dilation or effacement. If you don't know what that means, so the cervix, the bottom part of the uterus, the part where the baby comes out and then goes into your birth canal, the cervix blocks the entrance into the birth canal. So, in order for the baby to come out, the cervix has to thin, which they call effacement, and it also has to dilate. So, it needs to be 100% effaced or thinned out and 10 centimeters dilated for the baby to go through. So, you can be 2 or 3 centimeters for weeks, sometimes even months. Like sometimes women are like in that position for months and nothing changes, but labor can progress quickly too. So just because you're not a little bit dilated at 36 weeks doesn't really mean anything. But I don't know. I'm stressed out about it, even though I know that it doesn't necessarily mean anything. Like it's not going to happen or whatever, or I'll have to be induced, which I really don't want to have to be induced. Doesn't mean that it won't, because, especially for someone that's been pregnant before, which I have, this is my fourth baby, so it can go pretty quickly for women. My pendant is like twisted around, sorry about that. It can go pretty quickly for women that have given birth before more than one time. So even though I know that in my head, I keep like telling myself like, oh my gosh, like why is nothing at all happening? And I just feel like so huge and so tired and all the things. The heartburn. It's not the heart, and I've said this before in my other videos, the heartburn really isn't so bad if I, don't eat a lot of like salty foods or foods that are ultra processed. Um, and I do my best to eat healthy every day. So, for example, my meals today were breakfast. I had 2 small oranges, which doesn't sound like a lot, but I wasn't really that hungry and I've never been a big breakfast person anyway. So I had 2 small oranges, and then for lunch I had 4 cookies. So that wasn't good. That's ultra processed. And I made myself a iced coffee because I think I've also mentioned my heart issue. I can't consume caffeine or even regular decaf. I have to have the only caffeine I the only no, it's not caffeine. The only coffee I can drink is Swiss water processed, and the only one we've been able to find, or that my husband was able to find, is Tim Hortons has it. So I had that with like soy milk and just a little bit of brown sugar to sweeten it and cinnamon, which is how I like my coffee. I make my own specialty like drinks all the time, but that's one of my favorite ones is with cinnamon and brown sugar. So I had that for lunch, and I took my aspirin. And then the only other thing I've had to eat was my dinner, which was asparagus. When we got home from the hospital, I made turkey burgers, and I had mine on whole wheat bread, and I had asparagus. I roasted some asparagus in the oven. So, and I don't eat after a certain point because, first of all, heartburn, and second of all, like even before, and I think I've mentioned this in my other videos too, even before I got pregnant, I was on a journey to lose weight and like eliminate or more stringently restrict ultra processed foods. So something that I've done to go along with that is not eating after 7 p.m. Like I allow myself a bedtime snack around 6 p.m., which is usually I try to go for like fruit, or if I'm gonna have something like a little more indulgent, like maybe a couple of graham crackers with a little bit of peanut butter or something like that. But most of the time I try to go for like either fruit or, some fruit and yogurt and a little bit of oatmeal, something like that. So I will not eat again today until breakfast in the morning. So I also have been doing some freezer meals, since I'm already on the topic of food, just to have some things prepped. And I did a baked mac and cheese, which arguably is not the healthiest choice I could have done for a freezer meal, but it sounded good. And I don't eat a lot of pasta anyway, and the amount that I made will go a long way. Like nowadays when I have pasta, I usually do a cup of pasta max, but normally I try to go for like a third of a cup or like a half a cup of pasta when I eat it, and eat it with like a salad and some vegetables and things like that to fill you up. You get filled up on the fiber, so you don't feel like you need to eat as much of the pasta. So I did the baked mac and cheese. I'm doing a veggie lasagna, which is again pasta, but I don't eat like a ton of it when I do eat it. And the turkey burgers, one reason why I made turkey burgers tonight is because I had like bulk turkey burger. So my plan was to do them all up and then freeze for some freezer meals, freeze some of them for some freezer meals. So that's what I did. So I just made like a big pan of them and then stuck the rest in the freezer. So we'll have turkey burgers, and I'm planning to do a squash casserole. So that will be coming up. And I feel like I've made something else. Did I make anything else? Oh, the garlic parmesan chicken. I made that. And that was made as pasta as well. So I've done 3 pasta meals. I'm like, wow, but they were quick and easy to make, but I'm gonna have to balance it out with some other things because I don't want just all, heavy carbs and things. That's not really very healthy now, is it? No, it's not. But if you portion it correctly, and like I say, blend it, balance it with vegetables or salad or whatever, it's not bad. So tomorrow I'm hoping to do was looking to see what time I'm at, do the veggie lasagna and get that out of the way so it can be frozen. And I have an appointment with a neurologist tomorrow. Not looking forward to it, but it's at an office that I haven't been. It's a doctor that I haven't seen. I'm not anticipating anything transcendent to happen with that. They know I've had abnormal EMGs. They already know that. They know that there's lung and cardiac findings. Why they keep ignoring all of it, I have no idea. But I'm like, yeah, now my right hand, I can't really feel anything, specifically in my thumb. But I think what they're going to try and do is blame it on carpal tunnel, which I have 0 symptoms of carpal tunnel. And I'm not saying that I'm a medical doctor, but literally it came on suddenly too. It wasn't like, And if I was still working, you know, at my previous job where I was typing a lot and stuff like that, I could see carpal tunnel, but never had any instances, or not instances, symptoms of carpal tunnel. But I don't want to get ahead of myself, but I do think that that's what they're going to blame it on, the pregnancy, because of carpal tunnel, which I'm like, okay, whatever, it's not carpal tunnel. Because literally one morning I woke up and the muscle, you might even be able to see a little bit of the bulge. It's like way bulged out. Not as bad as it was in the morning I woke up like a month ago, but the veins were also popped out. Like that happened overnight. Like literally it happened overnight. That's not carpal tunnel. And now I can't really feel it. So there's that. And it does make, I've kind of adapted to it, but it does make like fine motor things difficult with this hand, which is my dominant hand. So we'll see how that appointment goes. That's a whole other appointment. I'm just like fried with appointments. I'm just looking forward to getting it over with, going in there, hearing them say, oh, well, it's probably carpal tunnel related to your pregnancy. Like, whatever. No, it's not. Did you look at my records? Have you seen that I've had 2 abnormal EMGs? I just wish there was a doctor somewhere that could like really and truly help me and listen to me, because I feel like since I've been ill, no one has listened to me at all. Like literally no one. What? Well, I can't say literally no one. There have been like 4 or 5 doctors. My pediatrician, Dr. Ecanum, another doctor, his name was Dr. David Spears, a neurologist, Dr. Joseph Hanna, and now who I'm seeing through maternal fetal medicine, who got me the referral to this other office, to this new doctor, this new neurologist, Dr. Cuppet. That's it. Over decades. I've been sick since I was like a teenager, mid to late teens. So I just wish there was someone out there that would actually be able to listen and look at the tests that have been done and see the abnormalities and piece it all together and offer some help, instead of just saying, oh, well, you're fine. No, well, I'm not fine because I haven't been able to work since 2024. So I would say that's definitely not fine. And no one is going to give up like thousands and thousands of dollars that they were bringing in net every month to get on Social Security. That's stupid. I have a master's degree. It's not like I want to sit home and not work. This is a total tangent, not even related to pregnancy. This is supposed to be a pregnancy vlog. But I feel like I need to purge and get this off my chest, because in the interest of telling all, the healthcare system in the United States, quite frankly, sucks. It sucks. They don't listen to patients. And I'm not saying every doctor. Some doctors are good, but overall, like we have like the system designed to just push medication and not listen to patients, not diagnose things. I mean, that there's a reason why we are so low on the totem pole of the hierarchy of civilized country healthcare. Like we rank so low for those reasons. Because, and I'm not saying universal healthcare is perfect by any means, but it's certainly better than the system we have here in the United States, because you pay hundreds and hundreds of dollars every month for health insurance, and you still have copays, and you still have to pay for medications, and you still have all these extra fees and charges. Then the flip side of that is if you're on state insurance, which I am because I have a disability claim pending and I'm pregnant, they treat you even worse. I think they only give you a little bit when you have private insurance, because they're more than willing to like bill and suck that money out of you. But if you're on state insurance, Medicaid, they treat you like garbage. They really do. They really do. I mean, during the time I've been on it, I've been told that, you know, that things, like I was told by one neurologist that they just couldn't help me at all, and that literally nothing was wrong with me, which is not true. I've had 2 abnormal EMGs. 2. Not 1, 2. Like that's not even a test from what I have been told by other neurologists, specifically and one of the neurologists that listened to me, Dr. Hannah, that they don't even do EMGs multiple times. Like, they rarely do it. They repeated it, and it's found the same abnormalities. And this idiotic, well, she was a nurse practitioner, she wasn't a neurologist, to be fair, but this idiotic healthcare person literally told me there was nothing that they could do. And she basically said, well, the state wouldn't want to pay for that, like extra testing. I'm like, excuse me? Well, I'm sorry. I actually paid into that program a lot. So I've paid into it. So I should be able to get the benefits of that. No, they would rather see you die. Anyway, I'm going to get off that tangent because it's depressing, but I feel like some of that needed to be purged. So there it is. Healthcare in the United States sucks, and I'm in a very precarious position health-wise, so who knows what's going to happen. I'm just looking forward to having the baby safely with no major interventions needed. That is my prayer. It's very scary. I feel like you're also discounted as a pregnant woman in the United States. Like, they don't see you as a person. They see you as this host of sorts. Like, and I care about my baby, don't get me wrong. I care about him a great deal. That's why I feel like I should be listened to more, because what's going on with me can affect him. So, obviously. So, I don't know. They don't listen. And if they do, the doctors that do, they're fighting the overall system that rejects centering the patient as the primary source of concern. So it's just, yeah, I feel like it's hopeless. Try not to feel that way, but anyway, my prenatal visits have been going well, so that's good. My blood pressure today was fine. It was 107/71, so I cannot complain about that at all. Very happy for that. No protein in my urine, no glucose in my urine, so those were all good things. And I guess we'll just continue to the finish line, and hopefully this will go well for both me and the baby, is my hope and my prayer. So on another note, I had a couple more items to put in my hospital bag. I'm going to switch over my ID and stuff tonight, so that's all done. So I'm just going to be carrying my phone purse from now until delivery, and maybe for a bit afterwards because it's small, and I'll be having a diaper bag when I'm out and stuff too, so a smaller purse will be beneficial. So that is done. I have my mouthwash, and I just need to make sure I put flossers in my toiletry bag. I keep forgetting to check for that. So I did pack the diaper bag. I think I might have mentioned that in my last video, so I might be repeating myself annoyingly. And my husband has his hospital bag packed, so yay for that. I was like, is he going to pack his bag or is he not? I packed some snacks for him, so we have some snacks. And I have been working on my wall art hanging for the baby, and I will show what I've done. I have one section left that I still have to complete for that, but I'll show what I have finished so far. So those are it, dragons and clouds. And then this is the last section, if I can get it in the frame, that I have to complete. So hopefully I'll be getting that done. I might work on it tonight if I feel like it, if I'm not too tired. And we'll see how it goes. And I will show my belly to see how that is coming along. This is what it looks like from the front. These are nice and stretchy. They're actually pretty comfortable. And the side, 36 weeks. I don't know if anyone else can tell, but he's definitely dropped. I've got like this weird, it's like up here it's like thin, and then it's like whoop. So that is that. And what else? Yeah. I can't think of anything else that needs to be added, so I think I'll wrap this up for now, and hopefully we'll be back either for labor starting or week 37 would be the next mile marker. Thanks to anyone for watching, and I hope you have a great evening, and we'll catch you later. Bye.